In terms of women compared to men, the numbers aren't nearly as high for women
Correct.
who lose hair, but it's still a significant problem, right?
Mhm.
Can you just tell us just a capsule summary of women, because we will have another show on that later.
Women, about half as many percentage-wise, women will lose hair as men, and it's generally a little bit more diffuse throughout the whole scalp and a little bit more on the sides. They hardly ever go completely bald like a male would, but it, as you can imagine, is also concerning to them as well. It's
I
less
think in a way there's
acceptable.
more of a stigma.
Right.
And I think more women maybe wear wigs, and so we don't know about it. In terms of evaluating hair loss, can you just use Anders and if that's okay?
Yeah, that's okay.
And explain how you do your evaluation, because that sounded interesting when we
Sure.
talked before.
What I first do is I will ask the person to tilt down so I can see the top, and then kind of look at the scalp, seeing if I can see any evidence of disease, any redness, scaling, hair loss.
Can you put your head even further down so we could come in? I'm sure the camera maybe is going to have a little trouble, but that'll make it more understandable.
Look through, and a lot of times I'll ask, Anders, where have you noticed most of your hair loss?
Right back here on the top.
And so that's an area that we'll focus in on, and then we'll gradually lightly pull, and I was able to get a couple hairs there. Don't worry, they would have come out anyway.
What is he doing to you, Anders?
Got about 4 that time, maybe 4 that time.
Anders wants to leave right now.
And 1 that time. And what I do then is I look at the base of the hair follicle that has come out, and
With the naked eye, or do you have to use a...
Most of the time you just look at it with the naked eye, and most of the time what you have is just a little white ball, or the club end of the hair follicle, and that's normal. That meant it would have come out anyway. So I didn't pull any extra. We also look, if it had been flat like the cut end would be, that might be a sign that he's over processing his hair, either over coloring it or over curling it, over perming it, that sort of thing.
You don't do those things?
No.
But he didn't have that type of hairs coming out. But that gives us an indication if someone is over processing their hair. If it came out pointy, that's the type of indication for the disease alopecia areata, where there's a lot of inflammation that's causing the hair to come out.
Now, with Anders, again, if we can use you, with this slight recession of the temple, is that part of what you call male pattern baldness? It's another part besides the actual balding on top.
Correct.
What does he have to look forward to in terms of the next 10 years if you wouldn't have any kind of treatment?
You most likely over the next 10 years will get some gradual thinning. Some of the recession in the front part of the hair would go back, and a lot of times the front actually meets the back, and some men have most of the hair or just a few residual hairs left on the very top of the scalp. But that varies as well, and that can be genetically predetermined. He can get an idea what he has to look forward by looking back at his ancestors. Since one person was completely bald and another side of his family's not had that much hair loss, he hopefully will look forward to having something kind of in between the two.
Now, men who are totally bald, are they dealing with a different kind of hair loss than Anders is in terms of male pattern baldness?
It's just a
More
different
advanced?
level, right, more severe case.
You said some interesting things before the show about the differences with different ethnic groups in terms of hair loss. Do you want to just reiterate those?
Sure. Caucasians have greater and more severe hair loss than Africans. They have kind of the next step down for severity and amount of hair loss. And
this is true for both men and women,
correct.
OJ? Okay.
And then Asians have less than the other two groups.
Any idea why that would be the case?
Probably genetics, I don't know. I guess the only thing that I could think of potentially would be the people that we mentioned that have less hair loss are also darker skinned, and maybe they needed that extra hair many ancient years ago to protect their scalp from the sun, because a lot of people when they're older have precancers or cancerous lesions onto the top of their scalp.
Oh, really? In terms of skin cancer?
So the hair can protect your scalp in that manner.
So if you, this is something I was not aware of, so if you do have balding, you are at a higher risk for skin cancer? Okay. With the increase in skin cancer, that's something for people to think about, isn't it?
Absolutely. When they're applying sunscreen, not to only apply it there, their ears, but hit that shiny spot.
That's good to know. Well, in terms of treatment, I've been reading some about treatment lately. It seems like there are some things on the horizon. What's kind of the good word in this sense?
Well, the good word is that there's a lot of research.
Okay.
Still, there's only one medical treatment for hair loss, and that's minoxidil, or Rogaine is the brand name. And there are a lot of other medications that are being pursued, but still have yet FDA approval for those medications.
But this is not something that is a totally, you take it and you get hair as thick as yours, right?
That's correct.
I mean, what kind of success rate, I guess, is there?
Minoxidil is a medicine that you apply to the scalp twice a day, and you apply it in the areas that are affected. The study showed that it grows hair in the vertex, or more or less the crown of the scalp, in about 30% of men after about 4 months. 30% of men get very good growth, moderate growth. 30% get a peach fuzz, vellus thin hair growth, and 30% get no growth. But it works best at maintaining what a person has. 90% of people who use the medication find that they aren't losing as much hair as they were previous to using the medication.
So you kind of hold the line, so to speak.
Right.
Would you say that's a more important use of it rather than regrowth in terms of your clients?
I think that's the case. Most of the time people will start using the medication and they're not really sure that they've really gotten a significant amount of improvement, and so they decide, I'm not going to buy another prescription of the medication. They stop, and several weeks to a month later they start noticing increase in their hair loss, and then they decide that they better get back on it again. And that's the reason, is because they notice that they've gotten some improvement maybe with the hair regrowth, but it's more that prevents the hair loss. So it's a medicine that you have to apply twice a day indefinitely.
Indefinitely.
Correct.
Okay, so that means, to hold that line,
Right.
if you quit taking it, you would lose that growth that you did have.
Correct.
That you got from taking it.
Right.
Okay. Now, you must have considered different options, or you wouldn't be here in a sense, right? What did you, kind of, what went through your head in terms of what to do about hair loss?
I don't know. At first, I didn't pay that much attention to it until I myself noticed that, looked in the mirror and like, it's getting kind of thin there. And so I was looking into, like, at one time I was like, buying a wig. No, it's nothing for me, like, or toupee or whatever.
Now, I read those toupees stay on no matter what. That's what the ads say.
Yeah, well, I don't know. I didn't look into it too much, and then I saw an ad and just went with it. And I'm going with this
So you're trying
medication right
minoxidil.
now. Yeah.